So without further hesitation, as we've got lots of exciting stuff to get through today, I will jump right in. My name is Meg Caven. I'm a senior research associate here at the Education Development Center and the Regional Education Laboratory Northeast Islands. I am joined by my colleague Clare Waterman Irwin, who's a research scientist and who facilitates the Early Childhood Workforce Development Research Alliance. We are here today to present the results of a study recently published entitled Center-Level Characteristics Associated with Turnover in the Early Childhood Educator Workforce. We're going to begin today with an overview of the study and the findings from that research, and move from that into a facilitated question and answer period in which we will be available to answer your questions about the study itself. From that point, we will spend the second half of the presentation in conversation with a number of panelists from the field who will bring their experience to bear on some of the findings from the research. You'll have an opportunity again afterwards to ask our panelists about their experiences related to educator turnover in the early childhood educator workforce, and then we'll bring us to a close, give you a chance to evaluate today's presentation, and send you on your way, hopefully with some new knowledge and perspective on this issue, which is important, I know, to a lot of us. So thank you again for being here. As I already said, my name is Meg Caven. I come to you from the Region Educational Laboratory at the Education Development Center, and I am joined by my colleague, Dr. Clare Waterman Irwin, who will be facilitating our panel today. She brings a ton of expertise in the early childhood sector, and we're thrilled to have her. So what is the Regional Education Laboratory? We are one of 10 regional education laboratories across the country. We work in partnership with local educational agencies and state agencies to use research to improve educational practice and outcomes for young people. We conduct applied research, and we provide technical assistance to states and districts as they work to use research to drive decision-making and implementation of various programs and strategies. I'm going to pass it over to Claire here to give you a little bit more background on the Early Childhood Workforce Development Research Alliance.
Great, thanks, Meg. And say that 10 times fast. I think we have to say that a bunch on this webinar, so please forgive us if we stumble over our words. So the Early Childhood Workforce Development Research Alliance is a collaboration among researchers at REL Northeast Islands and state-level practitioners across multiple jurisdictions, multiple states in our region, as well as the U.S. Virgin Islands. And so we really get together kind of as a professional learning community to discuss issues related to our 3 goals, which are to support the workforce development initiatives in the region through evidence-based training, coaching, and applied research. So of course this research study is that last piece of that. And to use research and data to enhance early childhood workforce knowledge and competencies. And finally, to develop evidence-based strategies to improve teacher working conditions and compensation with the goal of retraining a high-quality workforce. So those are the primary goals. We've been meeting now since 2017, and it's a very engaged and wonderful group of folks that we get to meet with. So we're very thrilled to be presenting the work that came out of this alliance. So Meg, I'll pass it back over to you.
Thanks so much, Claire. You always do that explanation with so much better nuance than I ever could, so I'm grateful to have you on the line. I want to take us forward into the study. So as I said, this study is about the center and program level factors associated with early childhood education workforce turnover. The study came out of the interest of the Research Alliance in what are some of the center and program level factors that are associated with higher levels of retention in the early childhood educator workforce. I should pause here in case there are any economists on the line to say this is definitely not a causal study. We're not looking for causal relationships between characteristics of early childhood centers and educator turnover. This is purely correlational, but the objective here was really to say, like, what are the types of centers that have higher and lower rates of turnover, and what can we learn from that in terms of improving policy programs and really within center practices. So I think the prevailing wisdom is that turnover is a problem in the early childhood educator workforce. In some centers, we know that turnover rates are as high as 25 or 30% in any given year. So why do we care about this? And I think there are many reasons to care, but I'm gonna draw out two, right? So we know that the early childhood period is a critical period for learning and for childhood development, and that a lot of that learning and development occurs in relationship and through relationships with caring adults. When those adults and when those relationships are disrupted because adults are moving in and out of positions in early childhood education settings, we know that that's associated with weakened language and social development for young people. And then from an organizational standpoint, there's considerable resources that need to go into restaffing positions when folks leave their jobs, and that those resources that are spent on hiring and recruiting new folks, that those are resources that get diverted from the work of teaching young people and building those relationships. So this study set out to answer two research questions. The first of which is, we know that turnover is a problem across the early childhood sector, but is that universally the case? Really, is turnover something that all centers are dealing with equally, or is there variation in turnover patterns when we look across centers? And if there is variation, the second research question is, what are the center characteristics associated with higher and lower turnover rates? To answer those questions, we use a nationally representative survey called the National Survey of Early Care and Education, which considers the use and availability of early childhood education in the United States. And many of you may be looking at this slide and going, 2012, that's nearly 10 years ago. Like, how relevant are those data to us now? And this is something that we have grappled with throughout the study. There are not more recent nationally representative data available through this survey yet. We are eagerly anticipating the release of the 2019 data, and I think it'll be really instructive to redo some of these analyses using those new data. But this is sort of the best we can do. We have since seen other studies come out, one most recently from Louisiana that said, give us very little reason to believe that things have improved much since 2012. That study found that more than a third of educators observed in their schools in 2018 were not there the following year. So that would say, similarly, turnover continues to be an issue of major concern. As I said already, we use a lot of descriptive statistics and regression analyses to sort of confirm some of the hypotheses we've unearthed. And our sample includes over 8,000 early childhood education center-based programs and over 5,000 early childhood educators within those centers. I will not drag us too far into the weeds on the data set in particular and the way it was sampled, but I'm happy to talk a little bit more about that in the Q&A if that's of interest to our audience. So jumping into our findings, I want to set us up for success here by sort of highlighting a couple of key terms that you're going to hear. The top line of which is private pay center. In the NSCCE, centers are coded as in terms of where they receive payment from. And the two options associated with the center level data are this center receives payment from some or all families, or this center receives payment from no families. So private pay centers, we have coded these private pay centers as indicating that a center receives payment from some or all families. And the flip side of that are free centers, which are the centers that receive payment from no families. And then I think important to flag our measure of turnover, which refers to the proportion of educators working with children under 13 years old who left their respective centers in the last month. So to begin our sort of dive into the findings, we know, or we think we know, that turnover is a problem in the early childhood education workforce. But to what extent is that problem consistent across the field? And we see here when we look at center-level turnover rates across the sample that there's actually a pretty wide distribution, a pretty wide range of turnover rates, right? Fully 50% of the centers in the sample had turnover below 5% in 2012. We called these our low turnover centers. We set a band between 5 and 20% and found that another 25% of centers have that medium turnover between 5 and 20% in a given year, and that fully another quarter of centers had turnover above 20% in that same year. Obviously, what we want to know next is what are the factors that are underlying this spread, right? What are the characteristics of high turnover centers and how do they differ from low turnover centers, in the hopes that, you know, understanding some of those differences might lead us to some policy or programmatic recommendations that could sort of stem the flow of educators out of some of those high turnover centers. So right away when we start to dig into the data, we find that there's one particular type of center that has significantly higher rates of turnover than all of the other centers. And these are our private pay centers, and specifically our private pay centers serving children birth through 5. These centers had, they comprise about 60% of the sample, so it's not an uncommon like institutional form. But they had higher rates of turnover than any other type of center. And, you know, you can see in this figure, they've got turnover rates at 16%, whereas, you know, even private pay centers serving only children 3 through 5, as well as free centers are all below, at or below 9% in terms of their average turnover rate. The next task is obviously to try and dig in a little deeper and say, okay, so what is it about these private pay centers serving kids birth through 5 that is different from all other centers that might be driving this higher rate of turnover? So when we dig in a little bit, we see that these private pay centers serving children birth through 5 differ in several ways from any other type of center. They pay lower wages to educators, offering, you know, below $12 an hour compared to almost $19 an hour as an average wage. They're much less likely to offer non-wage benefits. They tend to be smaller with a larger percentage of white students and a smaller percentage of Hispanic students compared to all other type of centers. And, regionally, they're sort of concentrated in the Northeast and in the South. I can get into this a little bit later, but I think it's important to note that in regression analyses, when we control for all of these factors, when we control for wages, which is a question we'll get into in just a second, these private pay centers serving children birth through 5 continue to have significantly higher turnover rates than other types of centers. So just put a note there. It's not just about money, but the money matters, as you'll see right here. So when we sort of dig into the question of center level wages, we see that this has a strong relationship to teacher retention. Centers in the bottom 25% of the wage distribution, so the bottom quarter of centers in terms of their average wage, their turnover rate was close to 20% compared to the top 3/4 of centers, where the average turnover rate is below 12%. And you'll see on this slide, we've actually marked that average wage. So in the low wage centers, the average wage is, just over $8 an hour. And then the top 3/4 of centers, that wage is doubled. And then the last finding we want to flag here before we turn to our panel is the issue of racial equity in the workforce. And how educators' experiences differ across different types of centers, right? And we find that if we look at those low-wage centers, they are disproportionately staffed by Black educators. So in our sample, nearly 40% of Black educators work in centers that are in the bottom 25% of the wage distribution, compared to 27% of white educators and 26% of Hispanic educators. So, while there aren't, interestingly, racial differences in, or we weren't able to detect racial differences in the turnover patterns of educators in the early childhood workforce, we do know that there is racially unequal access to higher paying jobs in the early childhood education sector. So I think I will pause here and offer an opportunity for Q&A about the findings of this study, and I know that my colleagues have been doing a great job managing the chat, and I look forward to your questions.
Great. Thank you, Meg. So this is Clare Waterman Irwin. Hello, everyone. I think I said hi briefly earlier. So we had some great questions from Amber in the chat asking specifically about what the definition of early childhood education center was, which I think you addressed to some degree. She additionally really was, I think, more curious about the content, so whether we drew a line between education or childcare. And my understanding of the National Survey of Early Care and Education data is that it's really, they don't make a delineation, and I don't believe that you did in your study, but I'd love to just pause and make sure that I didn't provide any misinformation on that.
Thanks, Claire, and thanks, Amber, for the question. Yeah, I think, so to answer the question, no, we did not make any delineation, and that was partly a question of the data, and it's partly political, I think. And, as we, work in partnership with state education agencies and professional organizations, there's really a very concentrated effort afoot right now, and I'm sure you know this, just for the benefit of those who are not as close to the field, to professionalize the early childhood educator workforce, to understand and appreciate early childhood educators as educators and not as babysitters. And so I think that, that we didn't have the data to distinguish between child care and early childhood education centers. Had we had the data, I'm not sure that we would have, because I think there's a compelling reason to view everyone working with young people in early childhood development settings to understand them as educators.
Right, absolutely, Meg. I agree 100%. And it looks like you've got some supporters in the chat as well. Again, bringing up, yes, the power to the profession, that's been happening, and other activities around that, absolutely. I do want to say, I'm not sure, Amber, I don't think we're implying that you didn't think that child care providers were educators, but your question was, point was well taken. I know I work a lot in universal pre-K, which is a mixed delivery system, and so sometimes there are assumptions made about the, whether the public versus the private child care centers. So this conversation is definitely ongoing, absolutely. I haven't seen any other questions specific to the study come up, so I'm just going to pause before we jump right into the panel, because we have an awesome set of panelists. Honestly, we're super lucky today. But I just want to pause and see if there are any final questions for Meg related to the study before we move on. I see some people are typing in the chat, so I'm just going to give it just 1 second. And yes, the recording will be made available. Absolutely. Great question. Also, in case we didn't mention it, or in case you're just joining, the webinar slides are available. There's a download today's files pod right underneath the chat. So you can also feel free to download the files now to have. Great, and Meg, yes, yeah, obviously we weren't making any assumptions, but it's always good to clarify that. Yep. All right, great. Well, we are going to jump. Oh, wait, Melissa, you got your question in just in time. So Meg, in the last bar chart presented, is the white educators group and the Hispanic educators group mutually exclusive, or is there overlap in the individuals in those groups? So I'm going to take the liberty to go back and Meg, let you address that question before we jump into the panelists.
Melissa, you're making me sweat about I had to answer this same question on a different report just yesterday, and I feel like I just don't want to confuse my data sets. It's been, the road to publication is long, and I haven't been in deep in the code in a while, but those groups are mutually exclusive. The way that we measure and think about race in data like these is approximate at best and really ill-suited a lot of the time. So the race variable that respondents are allowed to select does not separate race and ethnicity here.
So they are mutually exclusive?
They are, yes, they are mutually exclusive. You would be given the choice to select white, black, Hispanic, other.
Great, thank you. All right, so Melissa got her question in just under the wire. All right, so we'll go to our panel, which we're really excited. We have 4 fantastic panelists with us today, and we have 4 questions that we will start off with, but please, as we go along, absolutely jump in with questions in the chat. We will be monitoring that as well. So we have Pam Penton with us, who is the director of Meeting House Child Care Center in Newton, Massachusetts. She completed her undergraduate work in child study at Tufts University and the Elliott Pearson School and received a Master's in Education in Multicultural Moderate Special Needs from Lesley University. She has worked in the early education field for 40 years, serving families in Boston, Waltham, and Newton, Massachusetts. Thank you so much for joining us, Pam. We also have Amy O'Leary, who is the Director of Early Education for All, which is a campaign of strategies for children, an advocacy and policy organization that works to ensure that Massachusetts invests the resources needed for all children from birth to age 5 to access high-quality early education programs. Prior to joining Strategies for Children, Amy worked as a preschool teacher and program director, and she has served as the president of the governing board of the National Association for the Education of Young Children from June 2018 to 2020. She serves on the adjunct faculty at Boston University Wheelock College of Education and Human Development and Quinsigamond Community College. I apologize for those who are close to that college for mispronunciation, in Worcester, and Cambridge College. Amy earned a Master's in Public Administration degree from the Sawyer Business School at Suffolk University. She holds a bachelor's degree in psychology and early education from Skidmore College. Thank you also, Amy, for joining us. We're very delighted to have you. We also have Dr. Ernestina Fuentes. She is founder of Herencia Guadalupana Lab Schools, a nonprofit education center for vulnerable children. It is a unique organization based on social justice model that has nurtured the human potential of children for 8 years. Dr. Fuentes has dedicated 50 years to preschoolers in poverty. She was awarded a doctorate from Harvard in 1992. Dr. Fuentes, an immigrant from Mexico, returned to her childhood neighborhood in Tucson, Arizona to establish her school. She is a mother of 4 professional and amazing young men. Her love is to watch the aha moment of learning of young children. I think we probably all feel that way. That's fantastic, and it's great to have you, Dr. Ernestina. And finally, last but definitely not least, is Rachel Robertson. She has been in the education field for over 25 years. She holds a Bachelor of Science in Family Social Science and a Master of Arts in Human Development with an emphasis in learning across the lifespan, and a certificate in early education leadership from Harvard. She is currently the Vice President of Education and Development for Bright Horizons Family Solutions. In her role, she supervises the education and curriculum programs for approximately 700 early care and education centers, the professional development for over 18,000 educators and learning leaders, the development of family partnership resources, and works with the academic, nonprofit, and policy sectors on behalf of early childhood and Bright Horizons. She is also the author of numerous articles and books and hosts a parenting podcast, Teach, Play, Love, which I love the play on words there because I love that other book. Anyway, thank you so much for joining us, Rachel. So, as I said, we have an amazing group of panelists. They each are, we'll try not to just, recite the questions and just go down, but they each have something to add, I feel like, to all of these questions. So I'm going to start, Pam, just because I have you first on my list, with the first question that we have, which is, how serious do you perceive the problem of educator turnover in early childhood centers to be? And how has educator turnover affected your program or the work that you do or programs that you work with?
So I hate to say it, but as a small standalone center, it's very serious. I spend a lot of my day interviewing people or onboarding new staff, things that I need to do continuously throughout the year, which take me away from a lot of the quality things that I'd like to be doing with my staff. I have a very small administrative team. It's myself and my assistant director, and if we are short-staffed, then she and I are in the classroom, and then we don't get to work one-on-one with staff, be able to talk about their professional development, look at the quality that we're providing the children, and increase that piece. And that's a shame that we continuously have to revisit those pieces.
Yeah, that sounds, I think that link to the quality piece is super important because, as we all know, the quality side of things is what we're really trying to do, and that's really important. Amy, what are your thoughts kind of from a policy data perspective on this question?
Sure. I really appreciate what Meg said about 2012 and data sets and how important it is to have good data. And I think what we have learned over the last year is, you know, our work has really been seen about child care being critical to the economy, to economic recovery. Same challenges persist when you think about an under-resourced field for so long. I think now where we have federal dollars that are providing relief, we need to ensure that some of these dollars are used to address compensation and to supporting educators. And I believe that these, you know, we shouldn't call these one-time funds because we need to think about, we need to believe that we need these dollars. And I think with the retention piece, we have to think about right now, we're hearing that it's better to, you know, it's more lucrative to be on unemployment than it is to work in early education and care and many other sectors. So if we are serious about how critical early education and child care is to the economy, to our communities, then we all have to take a stand and advocating for not just additional resources, but sustainable funding. As you think of someone like Pam who's trying to, you know, run a program and often in the classroom, just, you know, and as she said, taking away from administrative time, we need to support all parts of the program to make sure that we can have that high-quality learning experience for children. And so I think really being clear about using the federal dollars, but also incentivizing state legislatures to make this commitment. We could have told the same story when I was a preschool director back in, you know, the 90s, early 2000s, and we now have a chance to do something about it, and so I hope we take that opportunity to really move toward action.
Yeah, thank you, Amy. I think, you know, I've been having these similar conversations with other folks in terms of it's really exciting to see how there has been some investment in, or there's been a bunch of investment of federal dollars, but that's not enough. That it can't be a one-time thing. And I live in Vermont, and I've been following it a little bit, and I think I see some of my Vermont colleagues on, and so they can definitely jump in the chat if they want to, but we just passed something that really does do that, the state really focusing on increasing funding for early care and education here, which is exciting. So I'm sure other states are moving in the same direction, and that's exciting. So Dr. Fuentes, I'd love to hear your thoughts on this. Meg assures me that you have a lot to say, and I think that that we'd love to hear your perspective.
Yes, I just want to give context. I have worked all this time with children in poverty and mostly foster care children, and I know the discussion about child care versus preschool is a touchy subject, but you know, we don't treat our educators the same. If they're child care, we treat them different, and that brings about a lot of the turnover. And so I think it is an issue, but I don't think we need to ignore it when we're looking at why turnover is happening. The difference between child care and preschool, I think, is a big factor. We do 0 to 12-year-olds, and because we're serving the total community with that age range, it weakens our preschool program many times because of the complexity of the community and the complexity of the needs across all those ages. So in that context, here's what I've found has happened because of the turnover. And if you consider pandemic, oh my gosh, it's a catastrophe. What's happened to us is we've seen an impact on morale. We've seen that the culture we had established is totally minimal because of all the change. The climate that we try to establish is weathered. The quality, in no exception, I think, of who we were like a 4 out of 5 star quality center. I'm guessing we're trying to give you a 1 and a 2 right now. It has also totally kept us away from continuing the high expectations we have, because there's so much work in bringing on staff and bringing them on board. Plus there's fear, there's insecurity, there's a horrific stability issue, and of course a horrible financial situation. So I think turnover now for our center is probably the most critical situation. And so we have indeed done incredible changes, because in the sense of all this chaos, we've realized what our weaknesses and strengths are. So we're addressing a lot of those, and when we get to question 2, I'll share some of those. But it is a horrific situation. When I read your study, I was happy to read it, but it reminded me of a geode. You know, when you open a geode, you see all these facets and you have no idea on how to comprehend them. And I think that's what the study has done, and we really need to be better defining things, better at categorizing things, and I think the report, the study, has given us a panorama, I think, of what we need to do. And just to close with this piece, I want to go back to Melissa's. I think turnover is important when we are looking at class and race and ethnicity. I'm a Hispanic woman, but I would have marked white because that's my race. And so I think we need to look at that piece, even though I know it's a touchy thing, but if you want really better results, I think we need to clarify who's where and who's who, and also who the clients are. What families are being served, I think, has a great impact on turnover. I've been in free centers, I've been in school centers, I've been in Head Start, I've been in high-level income centers, and now I've focused on children in poverty, and it's night and day in each of those centers on how turnover will impact people. So I'm excited because now we've opened the geode, but now let's get to work, I guess. Thank you.
I love that. Thank you. I love that, the analogy or the metaphor of the geode. I think that's absolutely correct. And, you know, we've talked a lot in our alliance, the concern over the mental health of educators, early educators, has come up, and something in addition to the factors that you talked about, Dr. Fuentes, has really been the issue of providing online instruction in early childhood and how they feel about what they're being asked to do in those situations. So it's been definitely a trying time, I think, for the field, compounded by where we were at before the pandemic. So thank you. Rachel, I'd love to give you an opportunity to also chime in from your perspective, kind of overseeing a larger group of early childhood education programs.
Yeah, I think I can just echo what everyone has said. It doesn't matter what state you're in, or if you're urban or suburban or rural area, we're all dealing with such intense focus on issues with the field and staffing right now. And we had these, I was thinking when you spoke, Amy, I thought when I was a center director 20 years ago, I was having the same conversation about turnover and all of the tricks and things that you do to try to keep staff and get staff. And it's harder than ever. We know more now. The difference is we know how consequential it is and that children's experience is at risk. So we have to get this right. And this last comment you all were making is something we're thinking about quite a bit, is the impact on the staff and the morale and the camaraderie and the constant change when they're already so taxed, and the leadership. And the best leaders and the best teachers are considering or are leaving the field because of all of this, and that hurts all of us. And we're spending time doing all this paperwork and shuffling and interviewing when we could be with children, giving them the best experience. So none of us are immune to it, no matter what state, what kind of center, what kind of program we're in.
Okay, thanks, Rachel. Yes. Okay, and I do see, thank you so much. There are some questions coming in the chat. I do want to follow up with question 2 first, because I think it follows nicely on the first question that we asked of the panelists, but we will jump over and leave time for your questions as well. So do please keep them coming. I think for this one, Rachel, I'll just keep it on you. I'm going to start with you this time. So what strategies have you used to reduce educator turnover? Kind of what has worked, and what tools do you think could be more effective?
So maybe the question is, what strategies have you not tried? Because that's a shorter list. I think I'll share with you all one of the strategies, two things that at Bright Horizons are unique, and I understand the ability, the ability for everyone to do this independently is limited, but as a society, we could be thinking about these things. So Bright Horizons has a pretty unique model in that most of our centers, if not almost all of them, have some relationship with a client, with the business community that supplements family or center finances, and that makes obviously a big difference for us in what we're able to pay and what we're able to, and the benefits we're able to offer the community, the amount of staff, all of the things that we know can make a difference. And I was thrilled to see that incentives for employers to get engaged in child care showed up in Biden's proposal because it works. It makes a difference. We need to get the people that are impacted by child care. We're losing women in the workforce. Employers care a lot about that, so we can really build on that momentum and get the employers involved. The other thing that we're doing at Bright Horizons, we offer a range of educational resources for clients. And so because we have expertise and that built in, we were able to do that for our own employees. So we offer a free child development associate program and free degrees. And that has a significant impact on turnover. Those that get that through Bright Horizons specifically end up staying a lot longer. Excuse me for the background noise. I'll mute now.
Great. That was really helpful, Rachel. Are you muting just for background noise, or are you passing the buck?
I can do both. Sorry. Yeah, I can do both. It was a good ending. But yeah, just to reemphasize that, I know Head Start has been talking about and exploring options about degree programs and asking teachers to get degrees, but not helping them get that funding, and asking people to go into early childhood when it's not a lucrative field. If we can have some solutions around that are federal or at least state solutions for that is, we can see, we have the data internally that is making a difference with our turnover.
That's great, Rachel. That's really helpful. Absolutely. Pam, I would love to hear your thoughts on this as well.
So I absolutely appreciate what Rachel does in a larger agency. We know that that's more challenging for a standalone center. However, as a director, I do make that a priority. So we do have small limited incentives for teachers to not only go to trainings that they don't have to pay out of pocket for, as well as some stipends for classwork. And I work closely with the area colleges to try and get free opportunities for them as well for conferences and classes and things like that. But really looking at what other things to do other than just salary and benefits. Like, those are really important. But also I give a lot of time to them. So I spend time in the classroom so that they have me in there. When I'm not substituting in there, I'm just in there to observe, and then give them time outside of the classroom to spend time with me to talk about that and reflect. Just like we're giving time to the children, giving time to the teachers is equally as important, and supporting them in, even if it's just talking about their joys and challenges and just hearing them, just being a listening ear to really support that. And that's so important. It doesn't put money in their pocket, which, we need to advocate for all those other areas as well, but so important to free up the directors or the support staff or whoever there is to be able to give that opportunity to the teachers as well. So that's really important.
Great. That's wonderful. Thank you. Thank you. We have about 13 minutes left, so we're obviously going to respect everyone's time and end promptly at 3. So I'm going to jump to a couple of questions that have come in through the chat that I think kind of relate, though. We can relate them to the last couple of questions that we have. So Claudia, you had asked about thoughts on what pre-service programs might do to address the turnover problem prior to folks going into the field. And I'm wondering too if this might relate to some of these ideas around equal access to higher paying centers across racial groups. I'm just thinking about how do we diversify the early educator workforce, and how might pre-service programs focus both on reducing turnover, but also maybe increasing the diversity in the workforce. I'm not sure if I'm trying to put too many things in one, but we have so many great questions coming in. I want to address as much as possible. Dr. Ernestina, I might jump to you on this one first, just to try to mix it up a little bit. So do you have ideas regarding pre-service programs and how they might address the turnover problem? I know you might have some thoughts, as you mentioned earlier, around increasing the diversity of the workforce.
Well, we kind of divide our recruiting into three pieces. The first is best fit, which is best fit for the individual and best fit for the organization. And I find that if you don't do that, you get them in and then it doesn't work because it didn't come out well, So we do a lot of work on finding out what do you want, what do you need, what are your talents, what are your strengths, what are your challenges, what are your preferences. So we do a lot of that. We also do like the STAR assessments, which is for our particular needs is an assessment for teachers who are going to be working in the urban area. It's out of the Haberman Foundation. We also do a protocol of questions, which is a teacher recruiting for urban education who has questions about people who actually will love to work with urban settings, because not all teachers are adept to that. So for our particular thing, we look at what's best fit for the individual and what they want and what's best fit for us, because we found if we don't do that, then we can go to the pre-training, all the other pieces that we think are important, and we find out there wasn't a good fit to begin. And that comes on with onboarding. Our second part is onboarding. We have teachers come in for a day and teach a lesson, spend the day with us. We also have them come into the school, but they stay in one training classroom for a whole month, because with children with special needs and with vulnerability and with a lot of foster children, it's a hard teaching relationship situation. So we want them to have as much training from seasoned teachers. So we do that. But of course, we do also, we're wonderful. We have Quality First, because that's a state program in Arizona where we can give associates or the accreditation or a bachelor's education to any staff that works 30 hours or more, and we do that. But before that wasn't working when we're talking about equal access, because a lot of the people, either minority or people that are in poverty, do not have the awareness, the steps, the perseverance to get into those programs and follow through on the skills. So we have like a prep program. We mentor them into the college structure. We mentor them into a class. We mentor them into FAFSA and all those things, because we can provide it, but they don't always use it. So that's it with that. And the last part to our piece is retention. And I think that's more the human part. What do we do for them? How do we encourage them? How do we praise them? How do we develop culture? How do we clearly let them know what our vision and our mission is and what their vision and mission is? So I think the retention part, outside of the money, is really important on a relational, social, cultural part to keep people that are committed and wanting to be part of who we are. Now on the benefits, it's very interesting about your benefit piece that came out in the study. I just had a teacher who I've had for 2 years. She's amazing. We've raised her salary. She's an assistant director now, and she'll be leaving because we don't have benefits. And so it's depending on the situation that the person is in, what's going to cause the turnover. So we had our new CEO, we have for the first time in our 8 years have a CEO, and we targeted him now to look at what benefits can we provide for people who need them so we can keep them. So that kind of gives you a panorama of the best fit, onboarding, and then specific retention elements, which I think are the personal social relationship piece.
Wonderful. That's wonderful, Dr. Fuentes. Thank you. So it is, we have 8 minutes left in the webinar, so I'm actually going to, this last question that we have relates to some of the questions that have come in. And so thank you to everyone. Please do keep the questions coming. We can circle back and review those questions even after and perhaps pull together something. So don't stop sending in the questions just because this panel's almost over. You never know what could happen next. So Amy, I'm going to jump to you because policy is, I know, really, really your thing. So what structures, policy, or support would help you in your efforts to reduce turnover?
So I think if you think what we've learned over the last year, so when you think about flexibility, so flexibility in funding, flexibility in policy, flexibility in the ways that we use the dollars. So, you know, I think what we were able to do over the past year in Massachusetts and many states is really be honest and truthful about the crisis that we were, whether it was the health crisis, whether it was, you know, educators worried to come back, educators risking their own health to come back to serve children and families, and people should not feel alone. And I think the community that has been created over the last year, both within the field and the acknowledgement from outside the field, is critical that it continues. I think this pipeline piece, we can't do any of this in isolation. So we need higher ed, we need high schools, we need to think about where are the opportunities that we could, again, be flexible, giving credit for prior learning. The Power to the Profession with NAYC and now with the new frameworks is really designed about making sure we're having these conversations in a structured way that will hopefully work to change policy in states. I think we have to also think about the mechanism. So much of the federal dollar is connected to a child, which is important, but we need flexible dollars that we can pay for educators to go back to school, to get raises when they continue their education, and to feel valued, which does mean seeing that in your paycheck. And so we have to get away from thinking that this is just an hourly job. While that is important, we need to think about being on salary, having paid time off, and health care.
That's great. Thank you so much, Amy. We're getting, yes, Sue, I think we're all on board, and Amy definitely. So it's 2:55, so we do unfortunately have to stop the panel because as much as I think I could talk to them all day long, and I'm sure all of you could talk to them all day long, I definitely want to respect everyone's time here this afternoon. So I'm just going to flip through these adorable pictures that we have and go here. So again, to download the study, you can go to the link. I think it was provided in the chat at some point. It includes both the full report, there's a brief, which is about 4 pages long, so if you don't have much time, that'll give you a little more detail than the 1-page snapshot. And then for those of you who are, you know, really want to know what the methods were and dig into all of that, you can go to the appendices. Those will be 4 different documents. Again, you can download today's files in the bottom left-hand corner. No, yes, that's left. I always have to remind myself. Bottom left-hand corner underneath the chat, you should be able to download today's slides. And this has been recorded. So you will get, by registering, you will get a little notification that it has been published. So we definitely will do our best, figure out maybe something we can do with the questions. I'm not promising anything, but I know a lot of questions came in for our panelists, and so we'll see what we can do. I'm sorry we couldn't get to all of them. I guess it's always a good thing when you have too much excitement about a panel rather than crickets. So, so thank you for all of your engagement today in the chat. I do see Meg did post the link in the chat directly to the study site, so you can check that out. And just a big thank you. This has been a lot of fun. I know I really enjoy these, but that may just be me. So thank you for joining us today. Today's webinar recording, like I said, will be archived and uploaded to the IES YouTube channel. If you registered for the webinar, as I mentioned, you'll receive an email from us with a link to the recording when it's ready. And I hope that no matter where you're joining us from, that you all have an absolutely fabulous rest of your day. Thank you so much.